So burn depth, I've mentioned, it often cannot be accurately determined in acute stage, especially that not so many changes has happened just yet. But in the latter part of your post-burn episode, you can see so many pathophysiological manifestations. So, accurately determining the burn depth during the acute stage is not too conclusive. So that's why we have another parameter to follow to measure this particular burn depth. Okay, so infection may convert to higher degree, especially that infection usually sets in within the span of 72 hours. So that's 3 days. When in doubt, overestimate. So, especially if you are in the emergency department and then you're going to manage a client who just came in with burns, and then you're going to do your estimates. Okay, when in doubt, again, overestimate. It's much better that you provide more than when you provide less interventions. Okay, so this is your burn extent. Okay, so we call it your body surface area estimation. Now, in order for us to facilitate the intervention that's needed for your client, you have to know your total body surface area. Superficial burns are not involved in the calculation because technically it's just superficial, from the word superficial. It's topmost, okay? And then we can do first aid with that. But for the most part, especially that we have deeper burn depths, you have to use two types of estimations for your TBSA. So we have the first one, it's your London-Browder chart, which is one of the most accurate there is because it adjusts for age. So for each particular age that you have specific percentages for each part of your body. I'm going to show to you later what is your London-Browder chart. And then you also have your rule of nines. This is, I think, familiar to you because I've discussed this one in CM 103. So your rule of nines follow the divisor 9 in dividing the body, adequate for initial assessment for adult burns. So I'm going to show to you the picture of your Lund-Browder chart. So this determines your total body surface area and then the specific age that is relative to that percentage. So if you are, as you can see in the tables here, you have 0 to 1 years of age. So you have your head, which is 19%, your neck, which is 2%. So it's rather very specific. And your anterior trunk, which is 13, posterior trunk, which is 13. So you must have this chart. Okay, I mean this chart already when you're going to do an accurate determination of the burn extent, especially if you're assigning the burn unit. Okay, but this would have to take time, by the way, especially if you're going to assess your client cephalocaudally, because this. Look at the areas on this side here. So you have head, neck, anterior trunk, posterior trunk, right buttock, left buttock. All areas are actually specified. So this is how it is when you do your Lund-Browder chart determination of your BSA. So on this side here, we have your years, okay, how old the patient is. So this is 0 to 1 year old, 1 to 4 years old, 5 to 9 years, 10 to 14, etc., etc. And for adult, okay, 16 years old and above. And then you have your second, your third percentage of your burn extent determination. And this is your total. Okay, so this is for your Lund-Browder chart. This is very accurate because it provides specific determination of percentage for the burn extent. Okay, as compared to when you have your rule of nines, this is just basically a general and very fast evaluation using the divisor 9. So for each body part or anatomical area that is going to be affected by the burns, you have the 9 as your divisor. So for the head, an adult client who has burns in the head, okay, this is the whole head. I'm talking about the whole head because percentage determination for anterior or posterior is also different. So since we're talking about this, okay, this is 9. That's for your face. Your back is 18. Okay. And then your whole thoracic area is actually 18, whether it's upper or lower torso. And then your whole arm, okay, is actually 9. This is 9. All of this one is 9. Okay. 9 is actually the whole head. Okay. If you're talking about the face, this is going to be 4.5. And then next we have your limb, your right limb. This is the whole circumference of your leg. And this one also would follow the same percentage, 18, and then you have 1 for your perineum. For the child, you can have still divisible by 9. You have 18 for the whole head, 18 at the back, okay, 18 in front, and then 9, and then you have 1, and then you have 13.5, 13.5, okay? So, total would be 100% for both the adult and also the child, okay? Next. So we have here your burn extent. I've mentioned that there are differences with the assessment and burn percentage, whether it's going to be anterior or posterior. So if you can see here, this is your anterior view of your client's anatomical landmarks. And then on this picture here, that's your posterior, okay? Percentage determination for the anatomical landmarks found at the back. So here I've mentioned earlier for the face, okay, that's front area of your head, that's 4.5. So we can see also at the back, if this part here is burned, this is also measured 4.5. And then for the upper torso, this is the chest, okay. So we have here from this point on, including your shoulders, and this part here, you are going to measure this as 9, while the lower torso, from this point on, middle part of your torso until this area here, okay, this is your 9. Basically, the whole torso or your thoracic area is 18. So, however, it doesn't necessarily mean that the burn would be covering the whole torso. So there are areas where it's just here or it's just here. That's why we need to divide that one. Okay? And then your perineal area is still 1. And then this part here, the front part or your anterior part of the limb is 9. Okay? Anterior part of the limb is 9. While the back part, your posterior part, is going to be 9. So, likely, this is divided again into rules of 9. Oh, by the way, I forgot you have here your arms. So, the anterior part, the whole anterior arm, that is 4.5, while at the back, posterior part of your arm is going to be 4.5. Total of that is 100%. Okay? Next, so we have here rule extent for the rule of thumb. So we also have what you call your rule of palm. So if a patient's palm is actually burned, okay, patient's palm is equal to 1% of his body surface area. So this we likely can associate like your perineum. Your perineum is 1%. So therefore, if the client has problems or burns in the palm, we can also consider that as 1%. Okay, but that's one of the considerations to the rule of the 9. Okay, next. So, what are the classification of burns? By the way, the TBSA computation will be discussed later on. We need to finish this one first, the identification of the different types of your burns. So, we have here your critical burns. What are considered critical burns? When we have full thickness burns involving the hands, feet, face, upper airway, genitalia, or circumferential burns of other areas. We also have full thickness burns covering more than 10%. So be mindful of the numbers. So full thickness area, 10%. And then another is partial thickness area, 30%, more than 30%. And then, I forgot to highlight this one, any type of burns which is associated to respiratory injury. That's why clients who have problems with, inhaling gas or inhaling, fumes from a burning building, or we can consider that already immediately as a critical burn because it might not be too obvious in the general external makeup of the client or physical appearance of the client. However, inside, your organs, your lungs, and other tissues are already affected very much. Okay? So, burns complicated by fractures, yes, we also consider that as your critical burn. And then, burns on patients younger than 5 years old or older than 55 years old, that would be classified as moderate on young adults. Okay? So, again, we need to remember our concept of fluid composition in the young and in the old. That's why clients in that specific age range would be given much considerations, okay, because we will consider them as your critical burns. And then next we have here your moderate burns, full thickness burns involving 2% to 10%. 2 to 10%. That's your clue there. With total body surface area affected, excluding hands, feet, face, upper airway, or genitalia. And then next, we have your partial thickness burns covering 15 to 30% of total body surface area. So this is your defining numbers, 15 to 30% for partial thickness burns. And for superficial burns, okay, to consider it as moderate burns, it must cover more than 50% of your total body surface area. So, if you have a sunburn, and then if you're going to compute the affected area and it's more than 50%, then likely you have moderate burns, okay? Next, we have minor burns. Minor burns are considered as such when you have full thickness burns involving less than 2% of the total body surface area. And then you also have your partial thickness burns covering less than 15%. So again, look at your numbers. Full thickness burns 2%, that's your minor burns. Partial thickness burns covering less than 15%. Okay, remember in the previous one, moderate, right? It's 10 to 15. Okay, so in partial thickness burns, less than 15%, that is your minor burns, and superficial burns, that is your covering less than 50% of total body surface area, that is your 50%. Okay? Next, so this is how we grade our burns, just a recap. If it's mild, it must be less than 5%. If it's moderate, then it must be 5 to 15% TBSA. And if it's severe, it should be more than 15% or 95% of the burns are actually seen. And all of these severe cases may require your burn unit care because of the potential for disability despite your small TBSA. So face, hands, feet, and perineum. Okay? Now, this is what I'm talking about earlier. This is your fluid resuscitation for patients who are having problems with your IV fluids. I mean, having problems with your fluid shifting, your third spacing. So, since fluid is lost, we provide what is missing. In the first 24 to 36 hours of your burn injury, you have to take note of that one. Okay, it's very, very important. So, Parkland formula is the formula that is needed so that you will know how much of your IV fluids should be infused to your patient so that you are going to catch up on the fluid loss. So the formula is kilogram times your body surface area percentage times the constant of 4 ml. So you have here for the first first 8 hours, you give half of that whole volume of fluid that is ordered by the doctor, and for the next half, that's your next 16 hours. Okay, next 16 hours of overall total, that's 24 hours. Okay, it's very, very significant that you need to do your fluid resuscitation within that span of time. So we have here a problem. Fluid resuscitation in burns. So this is the situation. I hope you can still remember your rule of nines, and I hope you can still remember your if I am going to be assigned, if based on experience, okay, we have not use your Landbrowder in the area, but I mean in some other burn units maybe they are going to use that. But speedy evaluation usually is relying on your rule of nines. So in this particular scenario, fluid resuscitation situation would be using the rule of nines for your percentage, identification of your TBSA percentage. So we have here a situation, a 35-year-old patient weighing 130 pounds, sustained second-degree burns in anterior upper torso, right arm, left palm. So the activity is, using the Parkland formula, compute for the IV that is to be given to your client in the first 8 hours and in the next 8 hours. Okay? So please mind the question. First 8 hours and in the next 8 hours. Okay? So how are you going to do that? There you go. A 35-year-old patient, 130 pounds, with sustained second-degree burns. You are going to identify first your TBSA. So it says here, upper anterior torso. Upper anterior torso. This is your upper anterior torso. shade that one. Okay, so this is 9. Plus right arm. It did not say anterior, right? It did not say posterior, just right arm. So you are going to assume that this, the front part, and the back part. Okay, so that's 9. And mention left palm. Where's the left palm? It's here. Left palm. What did I say about the rule of palms? It's 1%. So you have 1 here. Okay, so that is 19. So total body surface area percentage is actually 19. Okay, now we move to the next computation that you need to do is to identify. Because remember, it's kilogram times TBSA times 4 ml. That's your Parkland formula. We're done with your TBSA. Check. Then we go to your kilogram. So 130 pounds divided by 2.2, that's the formula. Okay? And we have 59 kilograms, 59.09 kilograms. So what's the next thing that we need to do? Okay, there we go. We have 59.09 times 19 times 4 ml. Okay, 4 ml. So, if that is the case, we compute it, and the result is this one. I want you to round it off. Okay, to the nearest ones. Okay, make it a whole number. So that is the whole IV fluid that you're going to give to your client. Okay, whole IV fluid that you're going to give to your client for 24 hours. Okay, for 24 hours. Now, the question is, how much of your IV should you give to your client for the first 8 hours and the next 8 hours? Okay? Now, to answer that question, this is that's 4,491 ml divided by 2. This is for the 8 hours and the 16 hours. Okay? So, if you're going to divide by 2, that's 2,245.5. Okay? 2,245.5 ml for the first 8 hours, because that's basically the half of this one. While for the next 16 hours, you will have 2,245.5 ml for the next 16 hours. But the question was, okay, what was the question? The next 18 hours. Next 8 hours. Okay? That was the question, right? Okay? It's not 16 hours. So what you need to do is to divide this one into 2. Okay? So for the next 8 hours, the computation would be to find how many IV fluid? 2,245.5 ml divided by 2. What's the answer? Okay, what's the answer? So, if we are going to divide 2,245.5 ml into 2, what's the answer to that question? That's, okay for a while. That's 1,122.75 ml. Okay? And then this number is what you're going to give to your client for the first, the second 8 hours. This is, remember? 8 hours and then 8 hours. So for the next 8 hours, this is what you're going to infuse to your patient. Okay? Now, if this is the number, if this is the volume of fluid that you need to infuse to your client, okay, 1,122.75 in 8 hours, okay, you also need to compute your fluid rate. Okay, let's say we're going to have this one. Okay, remember the long version of your fluid, FR, flow rate, long version of your flow rate is equals to V times dF, okay, over T. right? However, you can have the shortcut version. Flow rate is equals to V divided by, V divided by your hours. So that's 8 hours times the constant of 4. You will still arrive at the same flow rate. Okay? So that's why the flow rate for your client to have 2,245.5 in 8 hours is 70 drops per minute. In the same manner, you're also going to compute for the next 16 hours. So, okay, for the next 16 hours, you need to compute that using this shortcut version of your flow rate. That's volume divided by hours that you're going to infuse your patient's fluid and your constant of 4. So what happens here is that you're going to have to arrive 35 drops per minute. Okay? So that is your fluid resuscitation.